Kia ora.
Kia ora. Now, Liz, a lot of people want to know whether they should see a pelvic health physiotherapist or actually who should see a pelvic health physiotherapist. And it's a really common kind of question we get, isn't it?
Yep, it is. So I guess the first one that's really important that I want to talk about is that you need to be sure that you're doing your pelvic floor exercises correctly. If you're not, it's probably a good idea to go and see somebody. So you need to be fairly confident that you're able to contract, isolate the muscles, and relax well afterwards.
Yeah, that's a really big one, and it's really, really common. Most people really struggle because they can't see their pelvic floor to know that they're actually doing it right.
Yeah, and a lot of people have never heard of the pelvic floor, or they might have sort of never had a problem, so they've just ignored it, and they're not really sure where the muscles are or how to work them. So yeah, we're really happy to see people to do an assessment and make sure that they're doing them correctly. So there's other times, if you're experiencing symptoms, then it's a good idea, isn't it, to get in touch with somebody. So that might be something with your bladder, something going on with your bowel that's not right, also symptoms of prolapse, or perhaps you've got pain. So we can help people with pain with sex, pain putting anything inside their vagina, pain with any sort of sexual activity or getting erections, pain with vaginal examinations or using tampons. So all those sorts of things are indications that things might not be quite right and you could come and get some help. We also see a number of people with pelvic organ disorders and other pelvic issues like endometriosis or irritable bowel syndrome, and there's an association with pelvic floor dysfunction there. So that's something that's often not really known about. So we can definitely help those people too, can't we?
Absolutely. And the other time where people probably don't think about seeing a pelvic health physio is before or after any gynae kind of surgeries. And we can do a lot to help you recover following surgery, but also to prepare. The other time I would say is leading into pregnancy, so leading into childbirth, so while you're pregnant, but also that recovery afterwards. We see a lot of postnatal women as well. So antenatally, we can check that you're able to contract and relax your pelvic floor. And then postnatally, we can check and see how you've gone, how the pelvic floor is coping, how your recovery is going, but also that leads us into teaching a little bit about or working you back towards activity and exercise and getting you back to all the things that you'd like to do. And those are the times I think people forget that actually a pelvic health physio can be really helpful. So it's never okay to have any symptoms. We always say if you have symptoms, come and get some help.
And the other thing, I guess, is learning about what risk factors there are. So what you can change when you're pregnant or after you've had a baby or any time in your life to help prevent issues coming later on.
Absolutely.